Good morning, everyone. Together with my group mates, we are going to present to you the NIEMANN peak disease. So what is NIEMANN peak disease? So NIEMANN peak disease refers to a fatal inherited metabolic disorder. It is classified in a subgroup of lysosomal storage disorders called sphingolipidosis. It involves dysfunctional metabolism of sphingolipids. It is accumulation of harmful quantities of lipids in the spleen, liver, lungs, bone marrow, and brain. The history of the NIEMANN peak disease. In 1914, it was Albert NIEMANN published the first description of the NIEMANN peak disease type A, and in 1927, it was Ludwig Peak described the pathology of the disease. And in early 1980s, the terms NIEMANN peak type 1 and the NIEMANN peak type 2 were proposed to separate the high and low sphingomyelin forms of disease. And in 1961, Crocker proposed the classification of the disease that vary on the age of onset and severity. Is NIEMANN peak disease hereditary? The answer is yes, because the disease has an autosomal recessive pattern of inheritance. Both alleles of the gene must be mutated in such a way that function is impaired. If both parents are carriers, there is a 25% chance for an affected child with each pregnancy. Prognosis. Prognosis in type A, most approximately 85% cases being fatal by 18 months, risk to 2 to 3 years. Prognosis in type B, children may live a comparatively long time but may require supplemental oxygen because of lung impairment. Prognosis in type C, the life expectancy varies. Some die in childhood, less severely affected ones can live into adulthood.
So, the causes for type A and B is mutations in SMPD1 gene, for type C, mutations in NPC1 gene, and for type C2, mutations in NPC2 gene. Pathophysiology. Types A and B are caused by mutations in the sphingomyelin phosphodiesterase 1 or SMPD1 gene, leading to a strongly decreased activity of acid sphingomyelinase or ASM. The enzyme ASM is mainly present in lysosomes and converts sphingomyelin or SM to ceramide and phosphocholine. In ASMD, SM and its precursor lipids accumulate in lysosomes and cause cellular death. Type C NPC is further classified as type C1 or type C2 based on the pathogenic mutations in the NPC1 or NPC2 genes respectively. NPC1 is the predominant subtype affecting about 95% of the patient population. NPC1 and NPC2 proteins are present in late endosomes and lysosomes and are involved in the transport and intracellular mobilization of cholesterol and sterols. The loss of function of NPC1 and or NPC2 proteins blocks cholesterol egress from lysosomes, resulting in an excessive buildup of cholesterol in lysosomes. Consequently, toxic cholesterol accumulation results in cellular and organ damage.
So now let's proceed to symptoms of NIEMANN peak disease. First, let's start in type A. Hepatosplenomegaly, which means swelling and enlargement of the liver and spleen. Cherry-red macula on retina, lung disease and respiratory infections, neurologic and psychomotor deterioration, and developmental delay. In type B, there is still a hepatosplenomegaly, liver plus lung dysfunction, atherogenic lipid profile which defined as an increase in serum total cholesterol, low density and lipoprotein cholesterol and triglycerides, and a decrease in high density level cholesterol. Thrombocytopenia, a condition in which there is a lower than normal number of platelets in the blood. Neurological symptoms do not normally occur, but intermediate forms between type E and type B exist. Now, in type C, hepatosplenomegaly still exists, fetal ascites or liver disease, hypotonia, which is a term that describes decreased muscle tone, vertical supranuclear gaze palsy, that refers to the condition in which neither eye moves fully upward or downward. Cataplexy, the sudden loss of muscle tone while a person is awake leads to weakness and a loss of voluntary muscle control. And the last is epilepsy, defined as having two or more unprovoked seizures. Now let's move on signs and symptoms that related to the organs in which they accumulate. Let's start with type A. Large abdomen within 3 to 6 months. Cherry red spot in the eye. Feeding difficulties, which is called dysphagia. Loss of early motor skills, which is called ataxia. Rapid decline in the child after 6 months. In type B, abdominal swelling may occur in early childhood. No brain and nervous system involvement. Some may develop repeated respiratory infections and breathing problems. In type C, abnormal posturing of the limbs, trunk, head, and face, or dystonia. Enlargement of spleen and liver, hepatosplenomegaly, that may reduce appetite, abdominal distension, pain, thrombocytopenia. Jaundice at or shortly after birth. Learning difficulties and gradual loss of intellectual ability or dementia. Seizures. Irregular spit or dysarthria. Clumsiness and problem in walking. Sudden loss of muscle tone or cataplexy associated with laughter. Impaired upward and downward movement of eyes. Enlargement of bone, narrow cavities. Thinning of cortical bone. Sleep-related disorder, example, sleep inversion. Sleepiness during day and wakefulness at night. Bipolar disorder and depression including hallucinations, delusions, etc. So that's all for signs and symptoms of Niemann-Pick disease. Thank you.
Okay, so let's talk about the treatment of the Niemann-Pick disease or NPC. So let's talk about the treatment of the Niemann-Pick disease or NPC. Is there any treatment of the Niemann-Pick disease? So currently, it has no effective treatment for type A. Bone marrow transplantation for type B. A new treatment, miglustat, meaning a glucosylceramide synthase inhibitor, has been approved for type C. Hydroxypropyl beta-C cyclodextrin or HPBCD as a potential treatment for NPC. Individuals with type C and D are frequently placed in a healthy, low cholesterol diet and cholesterol-lowering drugs. Supportive care through nutrition, medication, physical therapy, occupational therapy, and being followed by a specialist can help relieve many symptoms, example pain and seizures. Parents may need to consider placement of a feeding gastrostomy tube or G-tube. Anecdotally, organ transplant has been attempted with limited success. So in type A treatment in Niemann-Pick disease, it has no effective treatment. No cure exists for Niemann-Pick disease or NPC. No effective treatment is available to people with type A or B. So for type B treatment, bone marrow transplantation, it encouraging results. So bone marrow transplantation has been attempted in a few individuals with type B with a mixed results. Enzyme replacement and gene therapy in phase 1B trial. So let us proceed to the treatment. Here are the several other treatment strategies under the investigation in cell culture and animal models of NPC or Niemann-Pick disease. That includes cholesterol mobilization, neurosteroid replacement, means a special hormone that affects brain and other nerve cells. Curcumin X receptor, means identified as a potential target. Here are the future possible treatments, maybe enzyme replacement therapy or gene therapy. For type C treatment, it has miglustat or Zodisca. This treatment approved on March 23, 2010 in Canada.
competitive inhibitor of glucosylceramide synthase, slows progression of neurological manifestation in humans. Current approaches to Niemann-Pick disease type C it involves supportive therapies and targeted management for specific symptoms. To synthesize or summarize, the Niemann-Pick disease is a lysosomal storage disease affecting metabolism that is caused by an autosomal recessive mutation, which means about the deficiency of either acid sphingomyelinase or Niemann-Pick C proteins, or NPC. So there are three main types of Niemann-Pick disease. These are the type E, B, and C. In type A and B, it means that the deficiency in is or ismase, which means that the accumulation of sphingomyelinase and a reduction in ceramides. The symptoms are hepatosplenomegaly, neurodegeneration, type E only, and the diagnosis is based on ismase activity. The treatment is based on the symptoms. For type C, the deficiency in NPC1 and NPC2, that means of abnormal storage of lipids and cholesterol. The symptoms are hepatosplenomegaly, epilepsy, fetal ascites, hyptosia, and the diagnosis is based on the Philippine stain or fibroblast for cholesterol content. The treatment are the miglostat, which means the slow progression of neurological symptoms. So here are the references.